And thousands of healthcare workers here in Metro Detroit who were fighting to help patients stay healthy are now fighting for their own health after exhibiting symptoms of COVID-19. 7 Action News reporter Kim Russell is live with more on the message doctors and nurses on the front lines want you to hear today. Kim, fill us in.
You know, I reached out to the state, and right now the Department of Health and Human Services is not keeping track of how many healthcare workers are becoming ill with COVID-19 or COVID-19 symptoms, but hospitals are sharing in some cases what they are seeing, and even they don't know exactly how many have the virus because there is a shortage of tests.
If it were up to us, I would test everyone because it just makes it a lot easier epidemiologically.
Dr. Harrison Tong says he has been told the shortage of COVID-19 tests should ease up soon. He's the emergency director at McLaren Oakland, part of the planning of logistics of what units can be changed into COVID units, getting supplies and staff. When it comes to staff, the virus is a threat.
And then we worry about staffing, we worry about those that become sick.
Some hospitals have been tracking how many staff are sick with suspected COVID-19. Taking a look at the numbers, Beaumont Health says about 1,500 healthcare workers are home with symptoms of the virus. At Henry Ford Hospital, about 700 healthcare workers are home with symptoms of COVID-19. And Michigan Medicine says as of Monday, 728 of its employees have been tested for suspected COVID-19, and 110 of them were positive. The president of the Michigan Nurses Association, Jamie Brown, who is also a critical care nurse, says she's angry there is not more personal protection equipment. She says there will be a long-term impact on our healthcare system.
If you have the nurses dying and then the hospitals aren't protecting us, who's going to want to go into nursing school to learn how to do this without any guarantees for your safety?
To make the supplies they do have last longer, you play a role. Nurse Brown and Dr. Tong say social distancing protects not just you, but healthcare workers.
We want everybody to stay safe, so stay home and try not to go out if you don't have to.
Without the public's help, there's no way. We simply do not have the manpower and the nursing staff, nor the beds, nor the equipment to take care of everyone.
And the sacrifice is real. We are hearing about doctors and nurses that are losing their lives after having suspected COVID-19. They are asking you to sacrifice some of your freedom for their safety as they work to get a hold of control of this virus. Reporting live, Kim Russell, 7 Action News.
And yet many of them are still running straight into the fire to protect all of us. So let's do our part to help protect them. Thank you so much, Kim, for the live report. It certainly is serious.